and both muscle and osseous material is more bulk. So this has an odd angle to it, which makes this center part of the clavicle the weak portion. I busted both of mine in football. They're easy to fracture. Then you've got the scapula, and of course the brachium, which is the upper arm, and the antebrachium, that's the forearm. Okay. So we're going to look at all the joints inclusive of the upper and lower appendicular skeleton. The articulating portions of the pectoral girdle are going to be the clavicle, the acromion process, the scapula, especially the acromion process, or the glenoid fossa, and the head of the humerus. Now, most anatomists stop it right there as far as shoulder girdle. But we have to include all because some of the muscles that are oriented in this area cross a joint to create a movement. So you've got an insertional tendon along with that muscle fiber, in this case the biceps brachii, and it crosses a joint so that elbow and forearm movements can occur. Okay, so we're going to include all of it as the appendicular skeleton. Now, this is the number of bones that are found in the upper extremities. You've got the pectoral girdle, there's 3 bones included there. A humerus, one ulna, which is on the medial side of the forearm. It's the pinky side, so the ulna is on the pinky side, and the radius is on the thumb side. And they have interosseous material or membrane between them that allows them to cross over and change positions. Supination, okay, pronation. So supination is the anatomical position you'll start with to study the bones. Okay? Always start in the anatomical position. Then we have 8 carpals in the wrists. There are 8. I'm going to give you a mnemonic for those. You'll never forget. It's not really dirty, just slightly. Okay? This is the proximal row, and this is the distal row. So the proximal row is going to be associated with the forearm and the upper portion of the wrist. Then we have a distal row that's deeper towards the fingers. Okay? Always start on the first digit side when you're counting or learning. It keeps you oriented, okay? Some lovers try positions that they can't handle. Okay? You won't forget that. I got that in med school. They gave that to me. So you got a proximal row, distal row. So the proximal is up towards the forearm. Distal is towards the metacarpals. Some lovers try positions that they can't handle. Okay. Scaphoid, lunate, triplectrum, pisiform. Okay. Trapezoid, trapezium, trapezoid, capitate, hamate. Okay. Always go in that direction. So you'll always start on the thumb on the anatomical side. And make note, I might ask you today after you study this, when you pronate the forearm, which carpal bone disappears from view? Okay. From the anatomical position to the prone, a carpal is out of view. Which one is it? Okay? Study that. Take a look at that. Clavicle and scapula. Once again, we have two sides to the clavicle. We have a medial side and a lateral side. The medial side is going to be articulating with the sternum, in particular the manubrium of the sternum. So this joint is called the sternoclavicle joint, sternoclavicular joint. That's what clavicular. The distal joint, clavicle articulates with the acromion process of the scapula. So this is called the acromioclavicular joint. PTs, OTs, you're going to have a lot of injuries in here. Okay? A lot of injuries in this lateral joint. Okay? So you got to know your tendons, your ligaments, and your muscles associated for rehab. Fush, falling on outstretched hand. That'll break your clavicle almost every time. Okay? So don't break your fall, just bundle up and roll or something. Okay? Fush, falling on outstretched hand. Okay? That puts a compression trauma up the upper appendicular skeleton to the clavicle and usually fractures midpoint because of its shape. It's the weakest joint of the body. So here you see a fracture, pretty ugly. This is going to require surgery with pins and plates. It's a bad break. But it can be rehabbed. Features of the scapula. Let's look at a scapula.
Leave the bone box.